Hi. I've been asked this question very often. What is liposuction? What does it do? So liposuction is a very simple procedure, and we make 2 or 3 holes, very small, 3 to 4 mm, and put in some fluid inside. Now what this fluid does is makes the plane avascular, melts some amount of fat and also emulsifies it, and this fat is sucked out, and at the end of the procedure you can see how much fat we have removed. So 2 liters, 3 liters, 4 liters, you can see in a jar. Now the result is also seen almost immediately. You can see that wherever we have done liposuction, your contouring is done, you get a good shape, and you can appreciate the result. So talking about technologies in liposuction, I don't do classical liposuction at all. So I use technologies. One of them is a power assisted technology called as MicroAire. The device is called MicroAire. It's a US FDA approved device. So what it does is, this device, when it's connected with the cannulas, they vibrate, so that the surgeon has to apply less amount of power, so the tissue trauma is less. The other technology is called Vaser. So Vaser, the cannula emits some ultrasound rays which melts and emulsifies the fat. So essentially what these two technologies do is, it makes sure that the wholesome amount of fat is removed. We don't leave pockets of fat. The other thing is the tissue trauma is less. You extract a lot of fat in almost half the time as you would do in a classical liposuction. So since the tissue trauma is less, the surgical time is less, you will have lesser bruising and swelling after the surgery. Your recovery will be faster and you will appreciate the contours much better. One more advantage of Vaser is it does some amount of skin tightening as well. So understand, in liposuction we are just taking out fat, we are not tightening the skin. So adding Vaser to a procedure, we make sure that we are doing good skin tightening along with it as well. So using these two technologies, make sure we give better results, better recovery, lesser downtimes, and better contours. And that's what patients want. So I don't do classical, and I use all these technologies in almost all of our patients. Now, since we have removed the fat, so understand, in any area of our body, there is skin, then there is some fat, and then there is muscle. So what we want, after the fat is removed, the skin should shrink and stick to the muscle, so that you get the contour which we have given you on the OT table. So after the surgery, you have to wear a compression garment which is made to measure. There will be a person who will be taking your measurements and design the garment for you. And this garment has to be worn after the surgery for at least 4 to 6 weeks, so that that shape which we have given you on the surgery table stays there for your better contour, and you are happy for that. Now I'm also asked very commonly that how safe the procedure is. So understand, if you get this liposuction done by a qualified plastic surgeon, a good plastic surgeon at a good center, it is safe. If you get it done by a good plastic surgeon and not a good center, it is unsafe. You get it done by a not so good plastic surgeon or not a plastic surgeon. So in India, you see a lot of people who say that they do cosmetic surgery, but they're not plastic surgeon by qualification. So if you get it done by them, then it may be unsafe. But if you get it done by a good plastic surgeon at a good center, it is a reasonably safe procedure. Now, depending upon what all areas of liposuction we have done, for a limited area of liposuction, the patient goes home the same day. There is no need of an overnight hospital admission as well. And the patient can resume their daily activities from the next day. Just avoid some heavy exercises for a few weeks. That's it. If you are doing multiple areas or large areas, then you may require admission in the hospital for overnight. And you go home the next day and again resume your daily activities and everything from the very next day. Now, there's not too much of pain, but yes, there is some discomfort which is going to be there after any surgery, and this gets taken care of by oral diclofenac or paracetamol tablets, and no stronger painkillers than these are usually required.